Hi, my name is Jason Langheier. I'm the CEO and founder of Foodsmart, Eating Well Made Simple. I'm a physician, and many years ago in 2002 started the Pediatric Obesity Clinic at Boston Medical Center, where we were able to reverse insulin resistance in most children that came through the program by creating a personalized grocery list of quality food that families could afford on food stamps. Today, we have over 700 employers and health plans, including many Medicaid plans and members. And I'll talk a little bit about how we help Medicaid members overcome food and nutrition insecurity at scale. Our vision is to have a world where all people are empowered to live healthy lives free of chronic disease. And growing up on food stamps myself, we're very passionate here about health equity. There are a number of barriers to healthy eating. It's confusing with all of the advertising that occurs in stores and the mixed information that comes through news channels and scientific literature. It's expensive, or at least perceived to be expensive, and people need help navigating how to find quality food that's affordable. But doing that can take too long without the assistance that we provide with our dietitians and our technology. A lot of things have changed, though, in the middle of COVID that have facilitated a new way of going about accessing quality food. One, consumers are moving to online food ordering, where you can strip away the unhealthy advertising from CPG advertisers, which is precisely what we do at Foodsmart. We also now can let people use SNAP online, which you couldn't do before the pandemic. And it's become more affordable to buy food online because grocers put new infrastructure in place because of the shift in supply and demand curves. It was clear that high obesity rates and unhealthy eating was linked to higher mortality with COVID around the world. And that food insecurity has spiked because of the change in the economy. But fortunately, regulatory changes have also facilitated new capabilities, such as telenutrition now being allowed beyond just Hawaii and Alaska around the United States for fee-for-service Medicare, and medical policies at plans, including most Medicaid plans, have followed suit in covering those to support their members. So the way that Foodsmart helps Medicaid plans is, number one, we're a marketing agency that takes best practices around using text messaging, especially with this new Supreme Court ruling, home mailers, inbound and outbound call center techniques, with really exciting messages around access to a personal food assistant supported by their Medicaid plan, access to discounts on quality food that fits the cultural patterns and food preferences that they have. And then we refer people in through providers and community-based organizations to dietitian visits that can be accessed even through a simple phone call with a flip phone. Doesn't require technology. In the background, our dietitians are trained almost like Apple Genius Bar representatives or Best Buy Geek Squad, but we select for very friendly dietitians who help connect with people after these 2 years of loneliness and social isolation, help take them on a journey of assessing whether they have SNAP and an EBT card, whether they're food insecure, whether they need help enrolling in SNAP, how to use SNAP with either online purchases or at the store. And then we use price comparison, since we're integrated with Walmart, Amazon, a long tail of grocers like Kroger and Albertsons and Instacart, to be able to highlight to people how they can access quality food at an affordable price for the long term. We also then, at the other end of this, generate an actuaries table for your analytics, clinical, and actuarial teams to show ROI in terms of both cost savings from improvements in hyperlipidemia, hypertension, and hyperglycemia, all generated through weight loss linked to the change in eating behavior we create, as well as a high net promoter score of 87 that we have with plans that allows us to increase retention of members with the plan, because they're offering this every week benefit that they come to affiliate with your organization. And we take people on a journey over time so that if they do have a smartphone, for example, or they can receive a smartphone from one of your other programs, we can teach them how to fish for themselves and consistently place healthy orders. We also facilitate healthy food directed spend programs and medically tailored meal programs with our partners, meal kit partners, restaurant partners through Grubhub, and even frozen meals and meal kits that can allow people to start with an induction diet or a food script to help overcome chronic disease. And then on the other end of that, again, share with you the results of those different programs. We put special effort into overcoming food insecurity with a number of techniques. We again assess baseline food security status with the USDA standard survey questions, which we supplement with questions on things like, do you have an EBT card? We do price comparison, as I mentioned earlier, nudge people to healthy but affordable recipes and pull discounts from all the major grocers. And we also take a look and see what kind of programs are available in your community, and government funding and philanthropic funding is already flowing into the zip codes you serve, so that you can connect those food incentives and capabilities to the dietitian programming and other chronic disease management programs that you have. But perhaps one of the most striking things that we do is price comparison. So you can see here an example in the Twin Cities, where actually Aldi and Cup Market are cheaper than Walmart, and you can save $10, $20 on your order. But then you go to another community, such as Portland, Oregon, where the local favorite Safeway is quite a bit more expensive than Walmart. So a health plan actuarial team shouldn't have to stress or worry about having to be expected to pay $20, $30, $40 per order into perpetuity for your Medicaid members to help them remain food secure. Actually, price comparison and discounts that are already available in the market should be able to do that. And you can really target your food incentives on the highest need for the individual. Maybe they're disabled or they're in a rural area in a food desert and they can't drive. So you can instead pay a much smaller amount to sponsor their Walmart Plus membership for a period of time. And that, combined with our price comparison, can help them permanently be food secure and getting access to quality food as well. And you can see that this varies by zip code. So another example where in Chicago, Walmart's quite a bit cheaper than Jewel Osco and a lot cheaper than Amazon Fresh. So we have a lot of proof points over 10 years of doing this work. A number of great organizations around the country in Medicaid plans, children's Medicaid plans, children's hospitals, community plans, Blues plans, large national plans. We have over 1.25 million users. We typically get 20% year one enrollment and a high net promoter score. A third of obese users lose 5% of weight or more at the 24-month mark. And we have a half a point drop in hemoglobin A1C at a much more cost-effective price point than medication and other disease management programs. And we will guarantee ROI or go at risk with pay-for-performance fees. I'll talk about more later. When we look at ROI, we look at all the different studies we've done on change in weight, where we get a similar result to the DPP, but at a fraction of the price. And more importantly, in our most recent paper at 36 months, we help people keep the weight off for the long term. We also see that 36% of our users with dyslipidemia return to normal lipid levels. We have a 10/5 drop in systolic over diastolic blood pressure and a half a point drop in hemoglobin A1C just based on diet. And you can see some of these charts here and how people who continue to do the program over time continue to lose more weight, sustain that weight loss, even at 36 months, and a major shift in the cholesterol ratio. And we're a lot more cost effective than statins, just as the American Heart Association says, you're supposed to use diet first. But now we've actually created a capability for providers and health plans to actually give to their patients and members to actually facilitate that. So in our SDOH-oriented ROI calculations, we add up the savings from hyperlipidemia, hypertension, diabetes, and hyperglycemia from other medications and gestational diabetes, subtract those out from the overall obesity savings, so we still capture the savings related to obesity, other costs such as musculoskeletal costs, and share that with your actuarial team. And you can see here that even at our discounted per member per month eligibility-based rate, we have a 3-to-1 ROI. Now I'll end by just highlighting that half the battle is just how realistic is it to implement programs like Foodsmart with all that you have going on with your plan. So a couple highlights on approval, contracting, implementation, and marketing. One, we have a very streamlined and simple LOA because we are a provider organization, just like any other telemedicine organization. We are the largest telenutrition provider group in the United States. And the Foodsmart Nutrition Network can do an LOA with you And then within 90 to 120 days, we can use your provider contract and go from there. And we found that that's a much easier way for health plans to work with us on contracting. We offer both pay for performance and PMPM eligibility-based pricing, plus standard medical nutrition therapy claims reimbursement in accordance with your existing medical policies and state rates for reimbursement for registered dietitians. A number of Medicaid plans prefer to go the pay for performance route, which we embrace given our results. We are very effective at security review. Our chief security officer used to be at Blue Shield, California, and Stanford. And Credit Karma, we've had over 700 enterprise clients. So we'll be very efficient with your security team. We implement in 30 days. And in that sprint, we take in your eligibility file. We optionally can integrate with one or more of your properties, digital properties with SSO or wellness platforms or other programs. And we put together a marketing plan with your team. And we are a full-blown marketing agency, so you can leverage Foodsmart to run your campaigns, use our best practices, but we get your approval on each step of the campaign, which can involve text, call, outbound and inbound, email, mailers, meal kits sent to home with an 800 number and a short code over text that people can get engaged and schedule their first dietitian visit. We will integrate with your different capabilities, such as your website, your mobile device, mobile app, your wellness platforms, disease management, and case management platforms. We focus a lot of energy on partnering with your preferred providers to train them on how to refer to our dietitians, where we can even also train their dietitians and give them access to dietitians that they can add to their clinic, and also help them do patient quality improvement campaigns. We work with local grocers and we tie in with local restaurants. We also collaborate with local community-based organizations and chef/athlete celebrities who are important to different sub-communities in your world, African-American community, Latinx community, and other communities that may speak different languages. So that we can make sure that people have trust and confidence and are excited about the program affiliated with your organization. So I want to thank you for taking the time and energy into looking into what we're doing, and just for the thought you're putting into how you can help your members overcome food and nutrition insecurity at scale. Thank you.